Hello and welcome to Iconoclasting with Sarah Smith. Today we have Alexandra, aka Allie, who I called Alex for a while, which I am so sorry about. And it's so embarrassing on my part, but Alexandra Allie Piatkowski. I'm learning all of the things about your name today and before, but Piatkowski, you had a great post on Pi Day about how to say your name.
Okay.
And you are the founder and CEO of Hyatt Public Health. So, can you tell us more about how did you start that? You've been in business for 3.5 years, is that right?
Yeah. Yeah. Thanks so much, Sarah. And thanks for having me. And no worries about the name. It's all good. I got lots of different pronunciations. So I made a fun video for Pi Day if people want to check that out. But basically, all you have to remember is pi, like the food or the mathematical symbol. And then you've got it. Yeah. So I went into consulting 3.5 years ago. I worked for another consulting company for several years before launching my business, Piat Public Health, full time 6 months ago. So it's very exciting and I'm loving it so far.
Okay, so I may be in the minority of people who know this, but I did not know public health had consultants or had a need for consulting, and so I'm floored by this. Tell me more about that because I don't know anything about it.
Yeah, absolutely. Honestly, I mean, consulting is such a broad field and term. You can really consult on anything. And so I think there can pretty much be consultants in any different field, which is really interesting. My background is as an epidemiologist. So basically, someone who studies health and what makes populations healthy or less healthy and basically what we can do about that. So my focus and background is really around data. I'm also a project manager. So basically in my consulting, I bring those different worlds together and it's all about helping health organizations better understand communities and the people who they're serving, make sense of different types of data and use that data to drive improvements to their programs and services or develop new programs and services and ultimately improve community health. So I do a lot of community needs assessment and engagement, program evaluation, strategic planning, and project and program management support. So that's the type of public health consulting I do, but there's so many other areas of public health and healthcare consulting as well.
That's so cool, and I love that you said it's like project management, data, and public health kind of all wrapped up together because that makes so much sense to me now that you say that. Did you go to school for public health? How does one do that?
Yeah. So I did my undergrad in health sciences, so kind of a
Okay.
general degree in health, which was good because I didn't really know exactly what I wanted to do in health. So it exposed me to a bunch of different areas. At first, I thought, maybe I want to be a doctor, something more clinical, because I didn't know about all the different possibilities. And then I discovered public health, and that just felt like a really good fit for me. I realized I was a bigger picture person. Like I like to look at things at a population or community level. And that's the approach I wanted to take to health. And that led me to pursuing my master's of public health, specializing in epidemiology.
And that's what an MPH is, right? Masters of
Hmm.
Public Health? Of
Yes.
course. Of course. I got it now. Here's a kind of off-topic question because I'm so interested in this, but do you think public health has, tie-ins to sociology when you're
Hmm.
looking at groups of people?
Yeah, absolutely. It does. There's so much crossover with social sciences. So I definitely had a lot of social sciences courses, including sociology in my degrees. I think, particularly in terms of all the different social and societal factors that impact our health. And that's a big focus of public health. Like, it's not just our genetics and our body and the healthcare system, but I think it's things like poverty and level of education, housing, employment or unemployment, discrimination, and just like the experiences that people have in society have a huge impact on our health. Yeah, absolutely. I mean, public health is so interesting because it's literally everything. Like everything
Yeah.
impacts health. And I mean, it gives us such a wide range of areas we can work in. It's also challenging sometimes to explain to people because it is so broad. But that's
Yeah.
one of the things I love about it as well.
Well, and you are Canadian and you are in Canada, right?
Yes.
Okay, so as our partner to the north, Canada and the United States have completely different, like, we're very different in our healthcare
Yeah.
landscape, is how I'll put it. And so when you work with people, are you mainly working with Canadian people or do you have American clients? Like, how does that work out for you?
Yeah, so it's a mix. The company that I worked for before was actually an American company, so most of those clients were in the
Mhm.
US. But since starting my business, launching it full time 6 months ago, my focus has been more in Canada. Still doing some work in the US. I'd say about 75 Canadian, 25 US at the moment.
Yeah.
So it's definitely been interesting to work in both jurisdictions and just see both the similarities and the differences. But a lot of the work that I do, in terms of data, strategy, evaluation, the methodology is the same. You can apply it in
Yeah.
different areas, but obviously there are differences in terms of our healthcare systems and
Yeah.
how everything works.
Yeah, that's true, and I have a feeling they can be pretty vast sometimes. So, you went to school for this, but did you ever think you were gonna, like, be running your own company when you were in school or ever?
No, absolutely not. I never thought I would be an entrepreneur. I thought I would work in the public sector forever. Like before going into consulting, I worked for government and hospitals for the most part and really enjoyed that. I think because it's public health, you kind of just think of it as the public sector. And when you're in school, you don't really learn about opportunities for entrepreneurship or even working within the private sector more generally. I think it would be great to share those opportunities more with people and just know that it's okay to think outside the box and there are other areas. Yeah, it was probably only 5 or so years ago that I considered alternative areas like the private sector and entrepreneurship.
And okay, so 5 years ago, we're in currently 2026, and that would have been COVID 6 years ago,
Mhm.
right? So, did COVID play a part in how you decided to go independent or go out on your own or however you wanna call it?
Yeah, I don't think it was COVID directly necessarily. COVID
Mm,
was obviously a very challenging and interesting time for everyone, but particularly public health. I wasn't necessarily focused on infectious diseases specifically at the time, but anyone who was working in healthcare and public health, it was like drop everything and focus
yeah,
on COVID. And I was working for a hospital at the time, more on the community side of things. But of course, the hospital needed a lot of help. So, like, we're helping them with their pandemic response plan and scheduling for who was going to be covering the COVID units and screening at the doors, running testing and vaccination sites in the
mhm,
community. So, a little bit of everything. So, I don't think that necessarily directly led to me pursuing entrepreneurship, but I think it did expose me to a wide variety of areas within public health and healthcare, and we all just had to
mhm,
be very adaptable and creative and ready for whatever came next during COVID. So I think it did get me outside of my comfort zone a little bit and interested in exploring different areas. It did kind of get me into project management. Like I was more in evaluation and epidemiology before that, and I started like taking the lead on projects more. And then I decided that was something I wanted to pursue more and get more project management experience. And
mhm.
that's been really useful for starting and running my business.
I think project management skills are transferable across pretty much in any industry, and they're
Mhm.
so important and so helpful. Just knowing how to get something to done
Yeah,
and do it with transparency and visibility and communication, those are very important.
definitely. Yeah, they're so applicable really in any field. Like they're never going to hurt you having project management skills. It's been very valuable for me.
Yeah, I definitely agree because it's something I kind of fought against for a long time of embracing my project management center, but it's helped tremendously for my career and
Mhm.
consulting in general. So what was the trigger that was like, I'm going to go full in on myself and Hyatt's public health?
Yeah, I think for consulting more generally, it was the fact that I had a lot of different interests and wanted to find a way to bring them together. I honestly feel like I get bored easily and I like to focus on a variety of different projects, different topics, different organizations. So consulting felt like a good fit from that standpoint. And I also love the lifestyle that comes with it, the independence of having and running your own business, the flexibility, the creativity, and the work that you get to do, and more independence and choice in the type of work that you take on. And I love collaborating with people, but I also love independent work. So I think it's a good mix of that in terms of my own independent work of running my own business, but collaboration with clients. And I love collaborating with other consultants too.
It's so much fun to be able to go from project to project. For
Mhm.
me, I think I might be undiagnosed ADHD or something. But that's the thing that really helped me fall in love with consulting in the first place was being able to solve something new every day or at least work with new and different people every day.
Yeah,
So the problems may remain the same, but I'm doing it with a different group. I have different stakeholders. I have different people I need to learn about and influence.
exactly.
That's really good.
Mhm. Yeah, yeah, it's very energizing when there's always something new to take on.
Oh, it definitely is. It definitely is. So tell me more about like how did you get the idea that launching your own consulting firm should happen?
Mhm.
Did you worked for a consulting firm before your
Yeah.
own? So how did you get to this pathway of like being, you got your MPH and you decided, okay, we've got COVID opening up doorways into project management
Mhm.
and data's always been important. We know that data is always important. But how did you make those movements to get to where you are now?
Yeah, absolutely. So, I think working for the other consulting company was, a great learning experience just to show me that consulting was a great fit for me. It was something I really enjoyed doing. The type of work I was doing was really interesting. It was focused on community health needs assessments and community health improvement plans for hospitals, local health departments, and their community partners. So that was something I wanted to continue doing. And just the experience of starting to work in the private sector and getting exposure to entrepreneurship, having not done that at all before, learning about business operations and marketing and business development. So it was all incredibly helpful. I also felt the desire to build something for myself. I was very inspired by that experience and felt like it gave me the skills to be able to build and run my own business. I was also interested in doing a wider variety of work in different areas to be able to do more work in Canada, and not necessarily just focus on those needs assessments and strategic plans, but to be able to have more of a say and shape the work that I was doing. And overall, I'm just very inspired by keeping the people and communities who are most affected by health issues at the center and making sure that they're involved in decision making and really closing the gap between data collection, evidence, and implementation because we often collect great data, we write these beautiful reports, but then nothing necessarily comes of them. So I really want to help close that gap.
That's so amazing to think about, like, yes, we have data. How do we use it? How do we make it widely available? And then how do we influence people, policies, procedures on
Mhm.
what that data is telling us and making sure we're interpreting it correctly is key. So that's amazing work that you're doing. I know that when I was in my undergrad as an English major, I didn't get some of the skills that like I am using now, and how I ended up going into tech was a very weird like 180 pivot. It was very strange for me. So I totally understand that. Um of being like, then you're going to do X, Y, and Z, and then you're turning out into A, B, and C. So that was very fun too. Uh, so thank you so much for coming on with this. I have one last question for you.
Mhm.
What would you tell somebody who's in this space or, thinking about public health and you've already said like get outside the box? What are like
Yes.
one, two more things that you would think about telling somebody who is looking at doing something different within this space or
Mhm.
pursuing something different or just, you know, breaking out on their own, taking a different road to travel? What would you tell them?
Mhm. I'll reiterate again the think outside the box thing just because I think it can't be said enough. You don't necessarily have to follow the traditional path in public health. You don't necessarily have to work for the government or a hospital or a research institution. Those are great, but there are pathways beyond that. And, be open to the private sector, be open to consulting, be open to combining different areas. There are opportunities for entrepreneurship within public health. And I think, the earlier that you can get exposed to different areas, the better. And just being open to areas that you may not have thought of before. I
Hmm.
think also it's okay to have a lot of different interests. As I said, I have a lot of different interests. I get bored easily. I have various different experiences and expertise. And I think that's okay. Honestly, I would consider myself a proud generalists. Some people have a very specific area that they want to focus on, and that's great. But I think there can be a lot of strengths in being a generalist as well and bringing
Hmm.
different areas of expertise and combining them in a unique way. Like epidemiology and project management are not necessarily commonly areas that go together. So that can be a real strength if you're combining areas that make you unique and definitely explore different areas, find out what you like, find out what you don't like as well. That's just as important.
I love that. Yeah, capitalize on your strengths and what you like doing because those are not always the same thing, right?
Mhm.
That's a really great one. And think outside the box. Those are great tips, I would say. The next time we talk, I definitely need to corner you and talk to you more about this sociology and
Mhm.
epidemiology. And those dovetails is what I'll say. It's so fascinating to me. I'm going to have to do some reading before we meet up again, though.
Sounds good. I'm
So,
excited to chat about that.
yeah, me too. Well, thank you again, Allie, and I will see you soon. Have a great day.
Thanks so much, Sarah. Take care.